Bismillah ar-Rahman ar-Rahim. Today we will present our lecture about some terms commonly used by surgeons: cyst, sinus, fistula, and ulcers. Cyst. The definition of cyst is a closed sac, usually filled with a liquid, semi-solid, or gaseous material. The cyst can be classified into two types: either a true cyst, where the true cyst has an epithelial lining, or a pseudocyst, which is composed of fibro-inflammatory lining, lacks an epithelium. Here we can see the true cyst lined by an epithelium, while the pseudocyst, for example, pseudocyst of pancreas, which occur following acute pancreatitis, the fibro-inflammatory material wall of the exudate and form the cyst. The cyst lack an epithelial lining. Pseudocyst lack the epithelial lining. Example of some causes of cyst: it could be a congenital, like congenital dermoid cyst. Here we can see the dermoid cyst at the outer canthus of eye. This is caused by a entrapment of the ectoderm at the fusion lines of the face. Another example, the branchial cyst, which also formed during the embryonic life, where the branchial arcs some of the ectodermal tissue entrapped beneath the ectoderm. Another example, the thyroglossal cyst, also the same mechanism. Another examples of the cyst: acquired epidermoid cyst. For example, the sebaceous cyst, epidermoid or sebaceous cyst. Both of them are the same entity. Actually, it is not a sebaceous, related to sebaceous gland, but the nomenclature of sebaceous cyst also describes the epidermoid cyst, which is formed by the entrapment of keratin and desquamate epithelium at the hair follicles. Here we can see the hair follicle, the punctum obliterated, and accumulation of keratin material. So it is an epidermoid cyst. If the cyst contains infected material, pus, then it is called an abscess. Sinus. The sinus is a sac or cavity connected to the surface epithelium. The difference between the sinus and the cyst is that the sinus is connected to the surface, connected to an epithelial surface. The sinus could be a normal part of organ or tissue. Example, the paranasal sinuses. Or it could be as a result of destruction of tissue. The cyst could be lined by epithelium, like the paranasal sinuses, the sinus, or it could be lined by granulation tissue. Example of sinuses: congenital one, the congenital dermal sinus. It forms at the midline. It is a part sometimes related to the congenital anomaly called spina bifida. Acquired, example, pilonidal sinus, which formed by the different mechanism resulted in the formation of a sinus that connected to the surface epithelium. When the surgeon opened the sinus, we find granulation tissue and hair. The hair lacks the hair follicle. Fistula. Fistula is an abnormal connection between two hollow spaces, technically two epithelialized surfaces. Example, we find a connection between the endoderm and the ectoderm. Fistula is a tract connecting two epithelial surfaces. Example of congenital fistula, the tracheoesophageal fistula, where there is a connection between the trachea and the esophagus. Other example, patent oracus, where an opening between the bladder, urinary bladder, and umbilicus. Fistula could be acquired. Example, fistula in ano, where there is a connection between the anorectal region to the surface in the perineum. Another example, the vesicovaginal fistula, which could be result after surgery in the pelvic region or as a result of malignant changes in the urinary bladder or in the vagina. Another type, the arteriovenous fistula, which is used in hemodialysis patient. The surgeon connects a branch from the radial artery to cephalic vein or basilic vein in order to increase the blood flow through the artery. This will stimulate what's called arterialization of the vein. The vein will become muscular and thick. This can be used to insert the catheter that used in hemodialysis. Ulcer. Ulcer is the breach of continuity of skin, epithelium or mucous membrane, and it is a kind of open wound. Here we see the mucosa of the stomach. There is an defect in the epithelial continuity. The parts of ulcer. The margin, here we can see the margin. This part represents the line of demarcation between normal and abnormal tissue, while the floor is the exposed part of an ulcer. The edge is the junction between the floor and margin, while the base is the structure on which the ulcer rests, usually felt by palpation. Types of ulcer. There are many classifications of ulcer according to the cause, according to the shape, but the most important classification according to the edge of the ulcer. First type called sloping edge, usually seen in healing ulcer or venous ulcer. The epithelium starts to grow toward the base of the ulcer. This is the sloping ulcer, sloping edge. Another type is the punched out ulcer. Example, in a trophic ulcer like an ischemic ulcer, a neuropathic ulcer, and encephalitic goma. Another type is the undermined edge or undermined ulcer, like what's seen in tuberculous ulcer, necrotizing fasciitis, and some of bed sores. Another type called the ruled out edge, which is seen in rodent ulcer. Rodent ulcer is the basal cell carcinoma. The tumor starts at the center and progress to the margin When it reaches to the periphery, the central part of the tumor starts necrosis, creating this ulcer. So the margins are elevated vertically because of the central necrosis. While the last type, called overhanging ulcer or everted ulcer, seen usually in squamous cell carcinoma or other type of carcinoma, where the growth at the margin more rapid than at the center. Here, the margins start to grow above the level of the surrounding tissue. Thank you.